The healthcare industry accounts for almost $3 trillion a year. It's a big business with a lot of money and lives in the balance. With so much at risk, how do we keep people from taking advantage of the system? Target 8 investigator Zack Newman found in just a 5-month period, multiple Columbia doctors took tens of thousands of dollars in single payments. Zack is here with more in the studio.
When you see a commercial for a drug product, you know they're trying to sell you something. But what about your doctor? According to reports, pharmaceutical companies spent almost 5 times as much money marketing directly to doctors than they do on advertising. But does all this money actually impact what drugs docs are giving you?
The evidence is very compelling that even small gifts influence prescribing behavior of doctors. I experienced that myself.
If little gifts influence doctors, what about big ones? Like this list of local doctors, which have taken more than $10,000 payments from drug reps in just a 5-month period.
There's no doubt in my mind that that would influence what I'm going to say.
How often do doctors take money? According to a report by ProPublica, the drug maker Pfizer spent money on more than 140,000 physicians in 2014. AstraZeneca came in second with more than 110,000 on the pay list, and Johnson & Johnson and Forest Labs each had nearly 100,000.
You're worth something to the company, you're actually treating patients. And if you're treating patients, most people don't want to harm patients.
Doctors say quality of care has not dipped.
They feel very strongly, and I agree with this actually, that they are doing good work for the good of society and the good of present and future patients. But the fact is that those relationships influence behavior.
The reality is, drugs are expensive to make. Companies spend millions developing, researching, producing, and marketing and selling a product. These corporations are tasked with the near impossible balance of creating great drugs and making a profit. And a doctor's preference for one drug over another can have a huge impact.
These are controllable costs where we could have potentially the same outcome, the same high-value outcome for a patient with drug X that's a tenth the cost compared to drug Y that is 10 times that cost.
Health costs have been on the rise, and a big reason is the cost of drugs. Drug companies need to make a profit, and appealing to docs is usually pretty effective. But a lot of this falls on the patient.
Most people kind of come in and say, I don't want to do anything, do what you want to do and carry on. So it doesn't work that way. You have to be involved in your own care. You have to know what's going on.
The money spent directly on doctors used to be higher. Since reaching its heights in 2007, spending directly on doctors has gotten harder and harder and less common. In fact, companies such as GlaxoSmithKline has stopped payments to doctors as a marketing strategy.
But maybe they're starting to realize now that there's a better way to do this. That maybe more of those resources will be used for actual research.
It creates a moral gray ground, leaving people to draw their own line.
I sleep very well at night because I know that every day I'm trying to do the right thing. And I know that I went into medicine to take care of people, and I happen to make a good income along the way. And if you're going into medicine to make a good income, you might be disappointed.
Late last night, surgeon Dr. Stephen Meyer emailed me to explain his $100,000 royalties that mentioned in the top 10 list from his role in the invention of a piece of medical equipment used worldwide during spine surgery. However, he never earns money on his own patients. To see which docs took the most near you or look up your own doctor, go to this story on KOMU.com.